After the arrival of COVID-19 pandemic, we used masks to protect ourselves from this deadly virus. To test whether the people have infected with this particular virus or not, we used the testing kits. And during the vaccination programs, we used syringes and needles. But what when we have used them? To answer this question, recently World Health Organization has come up with a report on the healthcare waste which has been generated after the arrival of COVID-19 pandemic. So hello everyone, welcome to all of you in the today's daily current affairs session on EduTap, and today we are going to discuss this particular report. Okay, so before beginning the session, if you are new to our YouTube channel, kindly subscribe it and press the bell icon to receive all the latest updates of the courses and videos offered by us. And you can also join our Telegram channel to get the access to the PDF of these sessions. To join the Telegram channel, kindly click on the link given in the description below. So let's move on to the session. Let's get started. And here you can see basically the title of this particular report, that is the Global Analysis of the Healthcare Waste in the Context of COVID-19. As the name of this report suggests, that this particular report has been released in order to analyze that what amount of the waste has been generated after the arrival of COVID-19 pandemic, what exactly was the impact of that, and what are the different recommendations with the help of which we can improve the healthcare waste management sector all over the world. And my dear learners, the very first important part that you are required to remember from here is the releasing body of this particular report, and that is the World Health Organization. So kindly mark the star here, as this particular part is really very important. Now, before discussing that what exactly are the key findings of this particular report, I want to tell you and discuss that first of all, what exactly is this biomedical waste. So my dear learners, this biomedical waste is basically defined as any waste which is generated during the diagnosis, the treatment or the immunization of the human beings or animals. And this is also the waste which is being generated during the research activities or the production or the testing of the biologicals. And these biomedical waste basically includes the human anatomical waste such as the tissues, organs, body parts. Apart from that, it also includes the needles, syringes, scalpels and the broken glass. It includes the discarded medicines, and the list is so long. So my dear learners, I really believe that it is very much clear to all of you with the help of this particular definition as well as this snippet that what exactly the biomedical waste is all about. So now let's move on to the key findings and let's see that what are the important points that you are required to remember from this particular report. And the WHO report states that over 140 million test kits which were having a potential to generate 2600 tons of non-infectious waste and 731,000 liters of the chemical waste, and all these particular test kits was being shipped. And what was the reason? The reason was to deal with the COVID-19 pandemic. And my dear learners, apart from the testing kits, this particular report also states that over 8 billion doses of the vaccines have been administered globally, and this could have caused and produced 144,000 tons of additional waste in the form of syringes, needles and safety boxes. And this shows that the healthcare waste management sector is reeling under the immense pressure after the arrival of COVID-19 pandemic. And this report also states that 30% of the healthcare facilities all over the world are not at all equipped to handle this particular biomedical waste. And apart from that, out of these 30% of the healthcare facilities, the 60% of these healthcare facilities are in the least developed countries. And what exactly is the result of this improper disposal of these biomedical waste? See, this exposes the frontline workers to the pathogenic organisms, burns, stick injuries, and it also affects the communities which are living nearby. And apart from that, it also affects the poorly managed landfills. So that was the key findings all over the world. And now when we talk about the key findings in India, then as per this report states that the daily biomedical waste generation in India during the first COVID-19 pandemic wave, then my dear learners, this report states that 101 metric tons of the COVID-19 related biomedical waste was being generated in India. And when we talk about the regular biomedical waste, then this amounted to 609 metric tons. And you must be surprised to know that this particular number, see, this particular number was a total of 710 metric tons, and this was an increase of 17% of the previous year. Okay, and now when we talk about the total available capacity for incineration of the COVID-19 waste in the country, then it was only 840 tons. Okay, so now my dear learners, when we talk about that what exactly are the different rules which are applicable in India in order to treat this particular biomedical waste in India, then it is the Biomedical Waste Management Rules 2016. And what exactly is the objective? The objective of these particular rules is to properly manage the per day biomedical waste which is generated from the healthcare facilities. And this particular, the applicability of the Biomedical Waste Management Rules 2016 are being expanded to include the vaccination camps, the blood donation camps, the surgical camps, or any other healthcare activities. And now when we talk about the recommendations which is being given by this particular report in order to improve and enhance the performance in the healthcare waste management sector, then my dear learners, this particular report states to follow the waste hierarchical model for the safe and sustainable healthcare waste management, which includes about the prevention as well as the rational use of this. And it also states that to not use gloves if not needed. And apart from that, here are some other important steps which are being mentioned by this particular report. Now when we talk about some other important recommendations, then these are basically using the enhancing and encouraging the use of eco-friendly packaging. It involves increase in the usage of the reusable personal protective equipments, and apart from that it also tells to increase the budget and financing in this particular sector. And apart from that, when we talk about strengthening these particular steps in order to make these particular policies more and more impactful, then it involves strong and national policies, increasing the accountability of the public as well, and apart from that, regularly monitoring the activities which are being taken place as a part of the steps which are being taken to improve the waste management healthcare sector in the country as well as all over the world. So these were the recommendations from this particular report. And now my dear learners, let's move on to when we talk about the PPEs, then in order to majorly treat the PPE waste, this particular 4-step process has been provided by this particular report. You can go through it. Now we are moving directly towards the practice question, and this practice question is being based on this particular report, that is global analysis of healthcare waste in the context of COVID-19. And in this particular question, what you are required to do, you are required to just tell me the incorrect statement as per this particular report which we have discussed in this particular session. And in order to answer the question, what you are required to do, you are required to analyze these particular statements and then tell me in the comment section below that what exactly is the right answer to this particular question. And here you can see, when we talk about these particular 3 statements, the very first statement says that it has been released by the World Health Organization. The second statement says that over 8 billion doses of vaccines have been administered globally, producing 144,000 tons of the additional waste in the form of syringes, needles, and safety boxes. And the third statement says that as per the report, 30% of the healthcare facilities are not equipped to handle the medical waste. So all these 3 statements are correct. So the right answer for this question will be option E, that is none of the above, as all these statements which are being mentioned here about this particular report are correct. So I hope that this particular question is very much clear to all of you, and this is one such question which can be framed from this particular report. And now let's move on to the googly question from the today's session. And today the googly question is basically based on a very important program which was being launched recently by the government, that is Chips to Startup program. And in order to answer the question, you are basically required to identify the correct statements in relation with this particular program. So do answer the question in the comment section below. Now when we talk about the homework question from the previous session, then in the previous session I have asked that which state has recently become the 35th state in duty to implement the One Nation One Ration Card plan, and the right answer for this question was option D, that is Chhattisgarh. So now when we talk about the star performers from the previous session, then the star performers are Neeraj Singh, Mintu Kumar, Surbhi, Prachi, Vishal and Shri. And if you also want your name to be mentioned here in the upcoming session, then kindly answer this particular question which is present on your screen. So basically recently the Indian Footwear and Leather Development Program was being approved by the Union Cabinet, and you are just required to tell me that what exactly is the financial outlay which has been decided for this particular program. Whether it is option A 1700 crore or option B 1200 crore or these particular three options, then do answer the question in the comment section below. And now my dear learners, I am having a good news for all of you that we are running a super sale in which we are offering flat 50% off on our combo courses, and for this particular part you can use the code combo. And my dear learners, if you are interested in purchasing the single individual courses, then for that you can use the code single. But please make sure that this particular code is only valid from 6th Feb to 8th Feb 2022. So this code is only valid till 8th of Feb 2022. Okay. So now my dear learners, that was all from the today's session, and I hope that today's session was useful and fruitful to all of you. And if you are having any queries, then you can drop us a mail at hello@edutap.co.in, and you can also call us at 814-620-7241. So thank you for joining us. Wish you all happy learning.